Greetings. Today we'll be discussing general ICU care. Approach to ICU. An intensive care unit or ICU is a specialized unit in the hospital that provides aggressive therapy using the state-of-art technology for both invasive and non-invasive monitoring in a critically ill and high-risk patient. Most institutions have an ICU with a team orchestrated by physicians with specialized training in critical care medicine. Types of ICUs. Most tertiary care hospitals have types of ICUs to attend to certain types of patients. General or surgical intensive care unit for post-operative patients. Medicine intensive care unit. Neonatal intensive care unit for providing care to a newborn infant. Pediatric intensive care unit which provide care for children. Coronary care and cardiothoracic units for providing care to patients undergoing cardiac surgeries or suffering from coronary artery disease. Intensive care usually takes a system-to-system approach for treatment. Intensive care treatment raises other issues which includes psychological health of the patient, pressure points and mobilization and physiotherapy, and secondary infections in the ICU. Setting objectives. The first objective is deciding which patients require treatment in the ICU. Care of the critically ill patient requires specialized training and skills, and the physician in the ICU depends on the nursing staff for accurate charting and assessment of the patient during the times when he or she is not available at the bedside, and for the provision of full spectrum of care including the psychological and social support and administration of ordered therapies. ICU patient, by virtue of their illness, present with complex pathophysiology and symptomatology. Patients to the ICU may be shifted directly from emergency department if required, from the ward if their condition suddenly deteriorates, or after the surgery if the patient is unstable and the surgery was invasive and prolonged. In general, ICU patients not only are very ill but also may have disease processes that involve a different number of organ systems. Therefore, for approach to a critically ill patient, one needs to be systematic and complete, and several issues need to be considered in the initial approach to the critically ill patient. The initial evaluation consists of assessment of A, B, and C, that is airway, breathing, and circulation, with simultaneous interventions performed as needed. An organized and efficient history, physical examination should be conducted for all patients entering the ICU, and a series of priorities for therapeutic interventions should be established. Depending on the severity of illness, patient care can be basic with intermittent monitoring, continuous monitoring in those who are hemodynamically unstable and need invasive monitoring and interventions, and those who need invasive ventilatory support. And the intensive care is equipped with monitors, respiratory and cardiac support, emergency resuscitation devices, and other life support. Equipments and systems. All ICUs commonly have the following equipments. Ventilators. The intensive care unit are equipped with mechanical ventilators for patients who are unstable and may require assisted breathing. Mechanical ventilators have non-invasive and invasive modes for ventilating a patient. Invasive modes include endotracheal and tracheostomy tube, through which adequate ventilation can be maintained. Mechanically ventilated patients need to be assessed frequently, and accordingly settings need to be done. Multipara monitors. Critically ill patients require invasive and non-invasive monitoring. Most of the ICUs have monitors which show pulse oximeter for oxygen saturation, respiratory rate, electrocardiogram to monitor heart rate, blood pressure monitoring, both invasive and non-invasive, and central venous pressure monitoring. Infusion pumps, which are used to deliver medications in a controlled and continuous manner. These are frequently used in patients requiring mechanical ventilation to keep the patient sedated, post-operative patients who need analgesia, or patients who are hemodynamically unstable and need inotropic support in a graded manner. Resuscitation cart or crash cart, which is fully stocked with medications for cardiopulmonary resuscitation and advanced life support. For the purpose of advanced cardiac support, patients might need to be intubated, and so drugs and instruments for intubation are kept ready in the crash cart, which includes laryngoscopes, endotracheal tubes of sizes, bougie, stylet, and forceps for difficult airway management. Defibrillator. Defibrillator has modes for manual defibrillation, pacing, synchronization, and monitoring. The monitor mode is a multipara monitor with pulse oximeter, electrocardiogram, and non-invasive blood pressure monitoring. Defibrillation is the major determinant of survival in cardiac arrest due to ventricular fibrillation or pulseless ventricular tachycardia. Integrating early defibrillation and CPR provides better outcome. Arterial blood gas machine. This machine runs a sample of heparinized arterial blood, that is blood mixed with small amount of heparin, and the analysis of this blood gas gives us the status of oxygenation, which is important for mechanically ventilated patient to titrate and optimize ventilatory settings. An example of ABG report which has following readings of pH, PCO2, PO2, and bicarbonate, which can be used to interpret the states of acidosis or alkalosis in a critically ill patient, and depending on which, further line of management can be planned accordingly. Assessment and basic interventions. Because of multiple medical problems, systematic gathering and presentation of data are needed for proper management of patients. To list a few, beginning with neurological assessment, mental status of the patient needs to be assessed, assessing Glasgow Coma Scale, and getting interventions done. For example, getting a CT scan done. Cardiovascular system. Inquire about the symptoms of the patient, getting an electrocardiogram done, noting blood pressure and pulse and volume. Accordingly, after assessment, if the patient requires further medical management, patient can be shifted to coronary care unit. Assessing respiratory system and intervening. Patient on mechanical ventilation needs special attention, monitoring respiratory rate, adjusting oxygen levels and modes of ventilation, and weaning off. Assessing arterial blood gases. Investigations which can be done include chest radiograph, renal or metabolic assessment, monitoring urine output and charting, routine investigations for electrolytes and other renal function tests, arterial blood gas analysis for acid-base assessment. Gastrointestinal, radiological investigations for diagnosis, securing nasogastric tubes in patients who are unable to take oral feeds. Nutrition. In a critically ill patient, the nutritional needs and what percentage of these needs is actually being provided must be assessed and then provided. One of the ways is to give total parenteral nutrition by calculating the required amount of proteins, fats, and carbohydrate. Prevention of infection in ICU. The intensive care unit is a high risk environment for organism transfer due to heavy traffic flow and large variety of healthcare personnel that come into contact with patients. Thus, it is of great concern to follow all aseptic precautions as we deal with critically ill patients, and hand hygiene is the most basic of it. While dealing with patients on mechanical ventilation, ventilator associated pneumonia needs to be prevented. For preventing ventilator associated pneumonia, care of the airway, frequent suctioning of the oral and endotracheal tube to clear out the airway is necessary. Most patients in the ICU need central venous access for monitoring hemodynamic status and to administer inotropic drugs, and it needs to be placed under sterile precautions with well-trained staff to assist. Proper antibiotic coverage should be provided. Patient positioning and care. Patients admitted into the critical care might require to be hospitalized for longer durations given the nature of the illness. Such patients remain immobilized for an indefinite amount of time. Oral care is important. Gargles with chlorhexidine is a part of oral care. Nursing staff should be instructed to change the position of patients to prevent bed sores. Bed sores are taken a note of in the nurse's charting, and care is taken accordingly with frequent change of position and air mattresses. Prolonged immobilization increases the risk of deep vein thrombosis, and deep vein thrombosis prophylaxis is an essential component in ICU care. Physiotherapy in ICU. Patients admitted to the critical care units remain immobilized for a long period of time and may be on mechanical ventilation. Physiotherapy can help in faster recovery of the patients. Providing chest physiotherapy in the patients who have weaned off of mechanical ventilation helps the patient recover normal respiratory function faster. Neurophysiotherapy, a specialized form of physiotherapy, is for patients who have neurological deficits post road traffic accidents or neurosurgeries. These are the references for this topic. Thank you.